Hello, I'm Melly Sims. I'm the Holistic Tooth Fairy. I live in Hamilton, New Zealand, and I'm recording this on the 17th of March 2020. And I just wanted to give people an update about what I have been finding out about COVID-19 and oral health, and in particular dental services. So a number of, well, more and more national and regional dental associations are advising dentists to close their practices and postpone elective or non-emergency treatment for the duration of the pandemic. Now, the dental profession in most countries, at least in the West, is dominated by private practices that aren't really regulated. And so some dentists may choose to stay open and offer their standard services, but I'm hearing stories from my clients about dentists closing down at the moment. So I think it's going to be pretty widespread lack of dental services for the next few months. Now, whether or not your dentist is offering services, there's a number of reasons why you shouldn't go to the dentist unless you're in an emergency at the moment. Probably the biggest issue with dental treatments is that there's several standard dental instruments and practices that carry a very high risk of virus transmission between patients and staff and between patients and later patients. So there's a kind of aerosol process that means that your saliva becomes a fine spray that spreads out from your mouth as they're doing work in your mouth. And as you're probably aware, those microparticles of virus can stay in the air for up to 3 hours. So not only as someone who carries the virus, whether or not they've got symptoms, whether or not they're coughing, if they're having dental work done, potentially this means the spray of virus particles is floating in the air for 3 hours. And so the staff are obviously at risk, but also the next patient who comes in to that room and sits in the chair, and the patient after them. So that is why the official advice is to stop delivering anything but emergency services, and the emergency services that are delivered are likely to be done in in hospitals where they can really limit the spread, the contagion, in a way that most dental practices aren't set up to do. Now, another reason for avoiding the dentist is that standard hygienist cleanings, deep cleanings, tooth extractions, and any procedure that compromises your gums can undermine your immunity. So if your gums are bleeding, and most of us who've had a dental hygienist cleaning have come away with at least some blood on our gums. That's the nature of deep cleaning, unfortunately. That is an opening through which infection can get into your bloodstream. So you don't want those kind of treatments unless you have to, unless it's an emergency and the dentist can take really good care of you, including afterwards, because you would be immunocompromised for as long as your gums were open. Now, having a hand or glove or instrument that is contaminated with a virus touch the mucous membrane inside your mouth means that you're vulnerable to infection. Those mucous membranes in our mouths, the inside of our cheeks, our tongues, our gums, they're all really permeable. And then there's some community reasons as well, so not just protecting our own personal safety, but surgical masks are in really short supply. I'm hearing a lot of reports from all over the world that there just aren't enough surgical masks available, stockpiled by hospitals and medical practices for what they fear will be the full extent of this pandemic. And so using a surgical mask for a non-essential dental procedure is potentially making it unavailable for when it's needed, when the pandemic kind of reaches its full height, full demand on medical systems. And last but not least is to keep dental waiting rooms empty. So just in terms of social distancing, not having a bunch of people waiting in a dentist's waiting room is another way to help flatten the curve. So those of you who are used to going for a regular checkup and cleaning and have one scheduled in the next few months, you might be feeling like quite worried about what will happen to your oral health in this time. And I will come back with another video in the next day or so with some home care solutions. But I wanted to get in there and give some information to the general public about what's happening with dentistry, because I haven't seen this being widely shared anywhere yet. Okay, I'll be back soon. I am Mellior Sims, the Holistic Tooth Fairy. Have a look in the caption and I'll share my details if you want to go to my website and get started on a whole lot of self-care and home remedy approaches to oral health. In the meantime, remember, you are the boss of your mouth.